Dan, and I'm so excited about this Wednesday session with our outreach program called Somebody to Talk to. As many of you know, I've joined One Amyloidosis Voice as both a presenter and a moderator for the weekly programs called Somebody to Talk to. And this Wednesday, our program is awesome. It's called Clinical Trials 101, where we have a clinical trials specialist come on and teach you everything you need to know about clinical trials for amyloidosis. Now, here's how it works. If you haven't been on one of our sessions before, people come on at their appropriate time, 3 o'clock Pacific, 6 o'clock Eastern, and they start coming on, and I welcome everybody on and just do some chit chat. When everybody's on, about 3 minutes after the start time, I'll introduce our expert, and they will speak for about 10 to 14 minutes on clinical trials and teach you everything you need to know to understand better and how to get the most out of your clinical trials and how to find them, etc. After that, we open this session up for discussion, where you can ask the specialist anything you want about clinical trials, or you can just share or discuss with the amyloidosis group. We've got people from all over the world that are on this session. It's basically a private Zoom call. And we've got people from all over the world, and they're sharing stories. And we've got a great group, a lot of regulars, people from, like I said, from all over the world with all types of amyloidosis. So I encourage you to come and join us. And when we're finished with the discussion and we end, you actually get a PDF file with summary notes from the session, which from all the takeaways. So it's absolutely incredible value, great camaraderie, and very inspiring from all the patients from across the country. This previous Wednesday, our session was incredible. This week's session was called Advocacy 101, and it was basically about how to speak up for yourself when you're in this new world of rare diseases and amyloidosis. Because if you've got amyloidosis, you know that when you step into your hematologist, or you're going to Mayo or Stanford, wherever you're going, everything's moving so fast. So you really need to learn how to not just stick up for yourself, but speak for yourself and ask questions. And it was a great session. It was led by Terry Wilcox. She's an expert in advocacy. We are honored to welcome Terry Wilcox, the co-founder and chief mission officer of Patients Rising, to lead our Advocacy 101 session today. Terry is a dedicated patient advocate with extensive experience in navigating and addressing the complexities of our healthcare system. Her work focuses on empowering patients and caregivers, ensuring they have the resources and support needed to overcome barriers to care. With a background in public policy and a passion for healthcare and reform, Terry has been a driving force behind numerous advocacy initiatives, including grassroots campaigns and educational programs. She is also a caregiver, bringing personal insight and empathy to her professional endeavors. Please join me in welcoming Terry Wilcox as she shares her valuable expertise and insights to help us be more effective advocates for the amyloidosis community. Terry, welcome.
No, thank you very much for that introduction, and it's great to be here. This is one of my favorite things to do is talk to patients, and especially about the issue that I'm most passionate about, which is advocacy. And at Patients Rising, we have 2 different types of advocacy, and today we're going to be focusing on Advocacy 101 in more of the self-advocacy realm.
She did an amazing job. We had fantastic discussions. People got a lot out of it, and it was just tremendous. And for example, here's our PDF summary notes from the session. Incredible, and you'll get these from the upcoming session. So again, this coming Wednesday, the 31st, 3 o'clock Pacific, 6 o'clock Eastern, and this one is called Clinical Trials 101. We'll have a clinical trials expert on, and we'll have amyloidosis patients from around the world. I'll be moderating and introducing the expert, and they will be sharing their expertise, and we'll be having discussion. So I invite you to come on board. The registration link, typically down below in the comments, depending on where you're seeing this, or it'll be somewhere close. If you haven't met me before, or you just stumbled on my channel, my name is Dan. This is my channel. I'm a cardiac amyloidosis patient, was diagnosed in 2017 with cardiac amyloidosis, 3 types of chemo through 2019. Now I'm on venetoclax or Venclexta, and I'm doing well. And if you just got diagnosed with amyloidosis, I suggest you take a look at my channel and take a look at the playlists and take a look at the visits, my treatment visits, because I basically, anytime I went to Mayo or for a treatment, I videotaped it and narrated about what I was expecting, what transpired, how I was feeling. And I've been told by so many people that it helps them along the journey, because when you're in this amyloidosis world, you're looking for somebody that you can role model, somebody that's done it before, so you know what to expect. And man, I wish I would have had that when I was going through it. I started making the videos for my family, so I didn't have to make 15 phone calls every time I went for a treatment, and it just grew organically. So I encourage you to check it out. And anyway, thank you so much. See you Wednesday, 3 o'clock Pacific, 6 o'clock Eastern. Somebody to talk to with amyloidosis patients from around the world. And our expert will be talking about clinical trials 101. I'll see you there.